A very warm welcome to all. Today we will know about the new chapter in pharmacology whose name is drugs acting on the eye. This means that in this chapter we will know what are the diseases related to the eyes and what medicines can be used for the eye examination. Let us first understand about its introduction. These are the drugs which used to treat the eye problems like infection, inflammation and reduction of the IOP intraocular pressure. In this we will learn about all the medicines which are used to treat the eyes problems. For example, any infection, itching, irritation, swelling, inflammation of the eyes or any kind of abnormality of the fluid presses inside the eyes that will be resulted pain inside and around the eye, blurred visions, blind spot, red eyes, irritations and may cause the discomfort to the eyes. And also I want to tell you that if IOP will too high, then it can damage the optic nerve. As a result, loss of the visions may be happen. So let us know about which drugs we can be used in the eye diseases. First drug is miotics. The drugs are used to produce miosis or constrictions of pupils are called miotics. Miotics are drugs or drops that will constrict the pupils of the eyes and then opens the blockage drainage angle. And we can use the miotics 2, 3 or 4 times daily. But miotics may cause the some eye discomfort and redness in the eyes. Next we are talking about the classification of miotics. First is muscarinic agent. Muscarinic agent mimic the actions of the acetylcholine on the muscarinic receptors and then cause the cardiac slowing. And contractions of the smooth muscles then rise the secretions from the exocrine glands tissues. So these are the examples of some muscarinic agents like pilocarpine, carbachol and other cholinergic agents. And muscarinic agents are also called the cholinergic agent. Next classification of the miotics is alpha adrenergic blockers. This substance which relax the muscles tissue in the blood vessels of the eye and pupils get the constrictions when iris dilated. Here are the some examples of the alpha adrenergic blockers like tolazoline and others alpha blockers. We will know when miotics drugs can be used. First, these drugs are used to treat the glaucoma. Miotics drugs are used to cure the glaucoma disease. Second, to control the mydriatics effects. If the size of the pupils is large, then this drugs is used to control it. Third, to prevent or break adhesion attachment between iris and lens. Using these drugs, we can separate iris and lens from each others. Next, we are talking about the contraindications of miotics. First, these are contraindicated during the pregnancy. We will not use miotics drugs during the pregnancy. Second, these are contraindicated during the lactations. We will not use these drugs on a woman who breastfeeds her child. And next, these are contraindicated in children because its safety is not clear. We don't use these drugs even on the children's because of its safety issues. Next, these are contraindicated in patients are above 65 years, and these are contraindication also in patients who are suffering from the cataracts. Means we will not give these drugs even to those patients whose age is above 65 years and the person who has had cataract disease. So these are the contraindication where we cannot give the miotics drugs. Next, we are talking about the doses of miotics. So these are the some drugs which we give to the patients according to the right quantity. First is pilocarpine. 1 to 4% pilocarpine nitrate drugs should be given as a drop in form. Second, tolazoline 1 to 2 mg per kg should be given by the intravenous route over the 10 minutes. Next drug is mydriatics. The drugs are used to dilate the pupils to perform easier and detailed examination. Mydriatics drugs are those drugs in which we dilate the pupils of the eyes so that we can do any procedure easily and its detailed examinations. Next is classification of the mydriatics. First is adrenergic agonist. In this, adrenaline and phenylephrine. Second, cholinergic antagonist in tropicamide and atropine cyclopentolate. They are used in the cholinergic antagonist. Mydriatic drugs are shown into classifications. The first is adrenergic agonist and the second one is the cholinergic antagonist. What does it do? It works to dilate the pupils of the eyes in the way. So these are the some examples of the mydriatics. Next is indications of the mydriatics. First, these are used to dilate the pupils. We have already studied it in its introductions, and this drug is used to dilate the pupil. Second, these are used for the examination of the retina and optic nerves. We also use these drugs for the retinal and optic nerves examination. Third, these are used for the diagnosis of the iris problems. We use these drugs to diagnose the problem of the iris. Fourth one, these are used to determine the refractive error. This drug is used to determine the refractive error as a disease because refractive error is a kind of a disease in which I cannot focus the image clearly and then cause the blurred vision. Next is contraindications of the mydriatics drugs. We do not use these drugs in the case of the patients with the hypertension, glaucoma, intraocular pressure, and we should be careful in this. Next, we are talking about the doses of the mydriatics drug. First is tropicamide, which is 0.5% solution. We take 0.5% solutions to dilate the pupils for 30 minutes nearby. Second, atropine, 1% solution. By putting 1% solution of the atropine drop in the eyes, the patient's eye can remain dilated for the 7 to 12 days. Last one, cyclopentolate, using 1 to 2% of these drugs, its effect lasts for the 24 hours. Next, we are talking about the glaucoma. It is an ocular or eye disease in which the intraocular pressure is increased and damage the optic nerves, which cause visual loss. Glaucoma is kind of an ocular disease that is called eye problem, in which the intraocular pressure increase. As a result of that, our optic nerve get damaged in a way. Due to this, visual loss may be occur. There are two types of glaucoma. First is open angle glaucoma. In this, it occurs when drainage canals are open but do not drain fluid properly. So this is called open angle glaucoma. In close or narrow angle glaucoma, it occurs when the pressure inside of the eyes becomes too high. It is an emergency situations and blur visions, painful redness, headache may be occur in the close angle glaucoma. Next is classifications of drugs used in glaucoma. From this classification, we will know how we can cure the glaucoma disease. The first way is that we reduce the production of the aqueous humor or do not allow it to made at all. So these are the drugs. They can decrease the productions of the aqueous humor. First, beta blockers. In beta blocker timolol topic 0.5% can be given, and in next carbonic anhydrase inhibitors acetazolamide oral 500 mg can be given. Next, in increase the outflow of the fluid, another way can be that we increase the flow of the fluid, then intraocular pressures can be reduced. Here are the some examples of the drugs that they can increase the outflow of the fluid, like in miotics pilocarpine topical 2%, and in osmotic azent mannitol intravenous 20%, and in prostaglandin topical 0.005% can be given. From these, the most commonly used are mannitol drug and prostaglandin drug, which we will discuss in further slides. Next, we are talking about the mannitol drug indications. First, it is used to reduce the intraocular pressure, means it is used to decrease the pressure of the intraocular. Second, it is used to reduce the ICP. When pressure in the cranium increases, it is used to reduce it. Third, it is as diuretics. It is used to reduce the volume of the urine. And the next fourth one is it is used to reduce the lower blood pressure. It is used to decrease the pressures of the blood. Next is contraindications. We will not use these drugs with the patients of the renal related issues, pulmonary swelling, edema, severe dehydrated conditions, and if the patients have any heart related issues, then we have to avoid these medicines to take the mannitol. Next is indications of prostaglandin drug. Prostaglandin is a famous drug which can be used to treat the glaucoma, to cure from the peptic ulcer from the GI tract, to increase the contraction in the pregnancy, and to manage the hypertension which is associated from the lungs disease. And this is also used to treat the erectile dysfunctions from a male gender for the sexual intercourse. So these are the indications where prostaglandin drug can be used. Next, we will talk about the contraindications of the prostaglandin. We will not use prostaglandin drug in some disease, for example, in bronchial asthma, renal disease, hypersensitivity person, in hypertension, and also in epilepsy cases. We have to avoid this prostaglandin drug in such cases. So this is all about the contraindications of the prostaglandin.